My name is Josephine Itam. I'm a nurse midwife at Procare Hospital. I'll be talking about facts parents should know about immunization. Firstly, immunization is the process by which we get vaccinated against preventable immunization diseases. And I would like to say that throughout lives, there are certain viruses, bacteria, microbes that fight our body. And scientists have made it that a lot of these diseases have vaccines that can prevent you from having these diseases, which could actually lead to illness, disability, and even death. And one of the importance is that immunization actually saves life. We could see this with some of the immunization as poliomyelitis, which we have tried to curb to the barest minimum. I think in the United States, they do not have any incident rate of that at all currently. In Nigeria, we have actually tried to curb it to the barest minimum that I think we have a ratio of just 1%. And we also have diseases like Haemophilus influenza, pertussis, tetanus, and the rest, which have vaccines that actually prevent these diseases. Also, another fact is that immunization is important such that it's important to the parents, the caregiver, and the child as well. Now, it's not the child who only needs this vaccine. You as a parent, you also need these vaccines. The caregivers also need these vaccines because the vaccines actually protect the whole family and the society at large, where if that family is protected, it means a particular ratio is actually protected because that child is protected, you as the parent, you're protected, your nanny is protected. Then vaccines are safe. And statistics shows that some people have related autism to vaccination, which is wrong. The myth is actually wrong because scientists have proven that there is no relationship between vaccination and autism. Immunization is also cost-effective in the sense that it saves you the stress. You treating or finding a cure for that particular illness, which is actually very preventable. So diseases like measles, mumps, rubella, varicella have proven to be preventable in that they have their vaccines, and it will be much easier for the parents to pay for these vaccines than treating these diseases itself. Number one, it's going to tell on their resources, on their psychological, because when your child is ill, you as a parent, you'll not be psychologically stable. So it's easy to get immunization such that we have a lot of centers providing this, and Procare Hospital happens to be one of the centers where you get your childhood vaccination and also adult vaccination. Childhood vaccinations such as BCG vaccines, rotavirus vaccines, penta or hexazine. I'm going to highlight on hexazine because we have a lot of parents who complain about pentavalent vaccines, being that it is very painful for their babies and it makes their babies cranky. Now we have a substitute, which is actually hexazine. Now, one thing hexazine does is that penta actually covers 5, while hexazine covers 6. And hexazine is pretty much less painful, I would say that. And also the fever that comes with pentavalent vaccine, it's much more reduced in hexazine. And also hexazine also reduces the number of needle pricks. Now for a 6 weeks vaccination for babies, they usually take about 3 injectable vaccines, but with hexazine, it reduces it to 2. So hexazine is one of the vaccines I really like parents to look into and give their child or children. And immunization also hurts for a few seconds, but gives your child the necessary protection for life. And we have parents who have really complained that after vaccination, their children tends to have fever and tends to cry a lot for like a day or two, sensitization will go a long way by the parents. First of all, you need to be knowledgeable that vaccines are antigens that come into our body. So when they come in, our body tends to fight it. So it is this process that actually gives the body the necessary protection. Now, that fever is just for like a day, and we've actually given them means of how to cope that. Number one, the baby may have fever for a day or two. Now, this fever is not going to kill the child. So one of the things you do is just that you try to wear your baby light clothing. Then you try to maybe use AC in your room, but minimal level, or fan. It actually helps with reducing the fever. Then you can also give paracetamol syrup as prescribed by your healthcare provider. Then you can also speak to your healthcare provider if you still think your baby is not still feeling too well. So you can speak to your healthcare provider. So the best reason for immunization for your child. A lot of parents think that, we hug our children, we kiss our children, we take them to school, we take them for outing. But the best thing you can do for your child is to protect your child against preventable diseases that are actually preventable with vaccination. So on that note, I would like to tell everyone out there that Procare Hospital is the best place to get all your vaccines. We have all vaccines for children ranging from BCG vaccine, IPV, PCV, hexazine, flu vaccine, rotavirus vaccine. For adults, we have the HPV vaccine, which is Cervarix. We also have varicella vaccine, which is against chickenpox diseases. We also have MMR, which is against measles, mumps, rubella. We also have hepatitis A and B vaccines. We also have the OPV. We have a lot of vaccination. Visit us at Procare Hospital today and get vaccinated. All right, so visit us at Procare Hospital today and get vaccinated. Thank you.